Exercise is always a difficult topic for us to cover when I'm dealing with children with Marfan syndrome. Although I encourage some level of exercise, very severe levels or competitive sports, heavy weightlifting, and heavy contact sports are really not good for people with Marfan syndrome. Anything that increases your blood pressure will put you at risk for enlarging your aorta and having an aortic complication. It takes many different conversations over time to get a child, or especially a teenager, to the point where he or she can decide for himself or herself what's safe. And it's some of the hardest conversations that I have to have with these kids. You know, some of these kids with Marfan syndrome come in with a lot of experience, good basketball players, playing lots of different sports, but it's really not safe for them to be competing at very high levels or doing weightlifting and strenuous training. And it's a challenge to have those conversations. The people with Marfan syndrome have more fragile tissue. You know, the tissue the ligaments that hold your lenses in place in your eye are not as strong as in most people. So if you get hit in the head, there's a chance that your lens could pop out of position, and that could seriously affect your vision. And the same thing is true with your aorta. Your aorta is more fragile. So if you got hit really hard, there's a chance that there could be a damage or a tear to your aorta. But there's something beyond the physical impact that causes me to ask kids to not participate in heavy contact sports. A lot of times sports that, like football and hockey, require very strenuous training, weightlifting. And so it's not just the activity of the sport, but it's the training that goes into it. What I like to encourage my kids to do is to try to enjoy sport for recreation. That's very hard for a kid who's very competitive. It's very hard for a kid who's been playing sports and really competing at sports for all his life. And the trick is to try and get that child or teenager to sort of think about sport as something to do for fun, for recreation, rather than competition. And sometimes we have to just take them completely out of sports because some kids don't know how to play moderately. And that's a challenge. But what I like to do is encourage them to find safe exercise, recreational leagues, situations where the training is not as hard, situations where the coach and the crowd in the stands are not going to be yelling at them, wanting them to just really push them to the limit. Recreation, not competition.